Hi, I'm Kristen Hodgden, IVF mom, proud women's health advocate, and co-founder of Rescripted.
And I'm Dr. Jenna Khan, a board certified OBGYN, fertility specialist, and mom of two.
And from first period to last period, we're diving into the women's health topics that matter most, from periods and fertility to pregnancy and menopause.
Through expert interviews and candid conversations, we're empowering women to take charge of their health by expanding the discussion beyond what's typically covered in the doctor's office.
It's time to stop guessing when it comes to our health. Now let's dive in for the real science-backed info you need to be the expert in you. Hey everyone, welcome back to From First Period to Last Period. We're here with a brand new season, and I'm here with my new co-host, Dr. Jenna Khan. Hi, Jenna.
Hi. Thanks so much for including me on this. I am really looking forward to the season. I think we've got a lot of great things in store.
Yeah, so for those of you who don't know Jenna, she is a board-certified OBGYN and fertility specialist, and I am the co-founder of Rescripted, and I am currently 37 and a half weeks pregnant and about to give birth.
How are you
So,
feeling?
that's where I'm at. I'm feeling good. I woke up with, like, a really bad Charlie horse and a bloody nose, so I'm pretty,
Ah, the
like,
worst.
psyched to get this baby out of me in the next, like, week and a half, but yeah, no, it's all super worth it. As many of our listeners know, I had a long IVF journey to get here, so take the good with the bad, right? Or the bad with the good. So, I mean, diving right in, this week, I mean, I don't know about you, Jenna, but I got chills hearing Olympic figure skater Tara Lipinski's raw and emotional story about battling endometriosis for I think 10 years. And she also opens up about her fertility struggles. We're going to tackle a question many women have but hesitate to ask: why does it burn down there after sex? Plus, we'll dive into the latest research connecting IUDs and breast cancer risks. And finally, if you haven't seen the new Netflix drama about the incredible women who pioneered or women and men who pioneered IVF, you're missing out. You know, everything from stigma, sexism, and a ton of skepticism, but ultimately coming out on top, obviously, because your job wouldn't exist otherwise, right?
Yeah, I absolutely love this, and we'll talk about it in a little bit, but I'm really excited for all the great stuff we'll talk about today.
Yeah, absolutely. So let's get into it. I'm going to go ahead and play Tara Lipinski's story. She's such a gem, and I was totally fangirling when I got to speak with her. So here goes. Her story unfiltered, raw, real, and rescripting women's health, one powerful story at a time.
Hi, Kristen and Dr. Khan. Tara Lipinski here. I'm calling in to talk about my own health journey with endometriosis. And boy, it's been a long, long road and a long journey. And when they say those stats of it takes up to 10 years to get a endometriosis diagnosis, they are certainly correct because I mean it's a very sad stat, but it's something that happened in my own life. I probably experienced my first symptoms that I noticed around 25 years old. And my symptoms were not the traditional endometriosis symptoms of heavy periods and terrible cramping. For me, I always just called it really bad stabbing butt pain at certain points. And I like to talk about this because it's like one of these things people don't really go around talking about, but it is an endometriosis symptom. And it's something that I think people will like maybe joke about here or there, or you even see on Instagram, there's like a funny post about it and or a comment, even when I came out about my endometriosis diagnosis, they're like, I have that too. But it was in this way where you really, I think many people don't connect the dots that this is actually a symptom of endometriosis. And it was something that I think delayed my journey because I just thought, oh, I don't have something like endo. And then on top of that, when you go to your doctor, or, I would go to my regular doctor or I would go to my OB and I would sort of explain my symptoms. And I feel like I never got an answer. It was sort of like, oh, that could be related to your cycle. Like everything looks great. So I was like, well, everything looks great. So you just keep trucking along. But the sad part is that so many women and people are dealing with endometriosis symptoms and pain for years before getting answers, before getting a diagnosis, or before getting treatment. And that is the part that I feel so passionate about now, speaking out about my story to hopefully change that for so many women because it can impact so many other areas of your life. Like when you want to build a family, which is, again, exactly what happened to me. I sort of just shelved all of these symptoms and never got an answer or a straight answer from a doctor. And then 10 years later in my mid 30s, as I am trying to build a family, endometriosis sort of snuck in there and caused problems. I have definitely experienced all parts of endometriosis. And I just know that the scale, though, of what women are dealing with out there, varies. And you can have silent endometriosis. You can have people that are in debilitating pain every single day. That's where my heart really goes out to so many people that deal with that on a daily basis and don't get answers. I mean, can you imagine how gaslit someone must feel in that moment? And then I think there's so many things out there that people may not know about. I know that during my journey, I researched and I learned about so many different ways I could advocate for myself. I asked for the Receptiva DX test during my infertility journey, and that was an incredible tool for me. Instead of just like all of these different variables that are thrown at you in these moments of diagnosis or infertility or IVF, I really had a clear look at what was going on with my body in that moment. And then I was able to make my own decisions of what was next for me. So that's pretty much my, you know, very short version of how endometriosis has impacted my life.
Well, Tara, if you're listening, thank you so much for sharing your story. I'm sure so many women can identify with what you've gone through and what you continue to go through with endometriosis. There are so many levels to this story that I want to unpack and that I think our listeners should understand. So I'm just going to dive in. Endometriosis is a disease that occurs when the cells of the lining of the uterus, so endometrial glands and stroma, implant themselves outside of the uterine cavity, which can lead to significant inflammation, pain, and infertility. 7 million women in the United States have endometriosis and can be found in up to 25 to 50% of infertile women. Classic symptoms are severe pelvic and low back pain, typically worse at the beginning of a menstrual period. Also, pain with sex and pain with bowel movements. As Tara mentioned, the gold standard for a definitive diagnosis is surgery, where a sample of tissue is sent to a pathologist. But surgery is not without significant risk. When the endometriosis has caused a large ovarian cyst, you could lose part or all of your ovary. When it's implanted on bowel or the bladder, you can imagine that the surgery just gets very complicated. And I don't want anyone to think that it's just a no big deal sort of thing to just undergo a surgery.
Mhm.
Luckily, MRI has gotten very good at identifying likely endometriosis. And I think most endometriosis specialists and fertility doctors would actually prefer to empirically treat with medications first
Yep.
to try to get the endometriosis to shrink. And whether that's to shrink it enough to relieve the patient of their pain or shrink it enough to make the surgery easier to perform. Um, you know, Going with the medication route first can often, not always, but often be a much safer route.
And that's the Lupron Depot that she was talking about?
Yes, I'm going to get into that a little bit too. So, just like the lining of the uterus is hormonally sensitive, that grows and sheds with the menstrual cycle, endometriosis implants too are hormonally sensitive, that will grow and shrink with hormonal changes. And this is why the first line of medical therapy is aimed at blocking hormonal cycling with continuous birth control pills. There
Mhm.
are other medications, Depot-Lupron, one that Tara mentioned is a stronger hormonal blocker that can be used for a limited period of time if the birth control pills are not effective.
Yep. Can you talk a little bit about, before going into, like, treatment, like, why you think that, it still takes an average of 7 to 10 years to get a diagnosis?
Yes, yes. So endometriosis is a very interesting disease in that the severity of the symptoms does not correlate with the stage of disease on surgical diagnosis. Like
Mhm.
someone with stage 1 or 2 mild endometriosis may have severe pain, and someone with stage 4 or severe endometriosis might have no symptoms at all. And I see this
Mhm.
all the time. That's probably one of the biggest reasons why it takes so long to get a diagnosis.
Yeah, so someone might be suffering from, like, debilitating period pain and then be like, have only, stage 1 and be able to get pregnant, but then someone else that has stage 4, like, does it correlate to infertility at all either, like the stage or
Not necessarily, no, which is also interesting. So if someone has large ovarian cysts, or large endometriomas that can which is seen in the later degrees of endometriosis, so stage 3 and stage 4, yes, that can contribute to infertility, but if you remove them, then you can improve your chances of pregnancy. When it comes to surgery, the catch is as well that like so you do the surgery, you remove the endometriosis, you remove scar tissue, but the catch is that you have to go on hormonal suppressing agents right away because the endometriosis can come back.
Mhm.
Or, if you're planning pregnancy, obviously you don't want to be on hormone suppressing agents, Lupron or birth control pills. And so you should be working with a fertility specialist, with whether or not that's the same person as your endometriosis surgeon to try and plan pregnancy right away. Like as soon as you recover from the surgery, go right into a pregnancy to prevent that endometriosis from coming right back.
So, and if you're not planning a pregnancy, then it would be birth control most likely,
Yeah,
right?
birth control.
Yeah,
Yeah, that's birth control pills, like or progestin only
yeah.
medications, whether that be pills or like
What
an implant.
what really stood out to me from Tara's story was that, like, she didn't even know that endometriosis was, like, it wasn't even on her radar for years and years, and, like, she wasn't having classic symptoms, like really heavy, painful periods, but she was having, like, those butt cramps, like she said, and we at Rescripted, we just want everyone to know, like, just know about endometriosis so that if you are experiencing any of the above, or even just unexplained infertility and can't get to the bottom of it, like, this is a condition that affects, would you say 7 million? How many women?
Women, yeah, in the
Yeah.
United States, yeah.
And it's a possibility
For
and
sure,
yeah.
for sure, and so I guess what there's a couple things I wanna mention here. So, my advice would be to listen to your body. If you're not trying to get pregnant and you're having really painful periods, don't be afraid of birth control pills to treat your pain because this is actually a very good treatment of endometriosis if you have it, and it can prevent progression of the disease.
Mhm.
If when you come off of the birth control pills and you continue to have pain, then this should maybe be your little like red flag. Like maybe I should get this checked out. Maybe I should speak to a fertility specialist so they can take a look or
Yeah.
assess um, whether my fallopian tubes are open or they can see any signs of cysts in my ovaries. Speaking with someone to have a better understanding of what's happening in your body and how that can impact your reproductive potential and further direct your care is probably the best thing that you can do to advocate for yourself.
Mhm.
And the last thing that I just want to touch on that Tara spoke about is this Receptiva DX test, which I do use in my practice. The Receptiva DX test is an endometrial biopsy test that can detect a biomarker of endometriosis called BCL6. This test was developed for use in the IVF population, specifically those with unexplained poor outcomes and repeated implantation failure. So, this test is essentially looking for silent endometriosis
Mhm.
and suggests alternative treatment strategies to improve IVF outcomes, and whether that be Lupron or surgery.
Mhm.
When you have a positive Receptiva biopsy, treatment with a hormone blocker, Lupron, for 2 months prior to an embryo transfer can lead to a 60% chance of a live birth compared to 11% if you test positive and are not treated, which is just amazing.
What I thought was interesting was that she actually used it in, like, the it actually worked for her in the opposite way where, like, instead of coming out she already knew she had endometriosis, but she wanted to see if, like, the inflammation associated with it had returned after surgery, and it turned out that it hadn't, so she went forward with another transfer without treatment, which I think is really useful because so much of infertility, as far as my own personal experience goes, is, like, not knowing what to do next, just using knowledge to make the next right decision for you without actually knowing, like, what the outcome's gonna be, so I thought that was pretty powerful too.
Own your health, your questions and expert answers, because you are your own best advocate.
So in this segment, I'm really excited. We're going to be answering like these are the real no holds barred questions that our community at Rescripted sends in. And if you want to send it in your questions, keep listening because we tell you how at the end. But we love getting into these. Today we've got three hot topics you've been dying to know about. First, why does my vagina burn after sex? Um, can you speak to that a little bit, Jenna?
For sure. So, by and large, the most common reason for this to happen is friction. And so friction can come from vaginal dryness related to low estrogen or just lack of lubrication and need for more foreplay before sex. If you are experiencing an issue with friction, and trying to get pregnant, then using a water-based lubricant is going to be best for you. And then if you're not trying to get pregnant, um, things like silicone-based lubricants might last longer and provide you more relief for longer durations of time.
Okay.
Um,
So it's not like a medical condition or anything like that. It's
Well,
pretty normal.
the most common cause would be just the friction, which is not necessarily a medical cause. I mean, if you are under like in the menopause transition and your estrogen levels are low, like that could be the cause of the low estrogen and the friction and need for lubrication.
Mhm.
Um, but it also could just be like need for more arousal. The sort of medical causes of the burning with intercourse is like allergy to condoms or lube, and so you can sort of work through that. You can see your gynecologist and have them look at the tissue after using lube or condoms, or you can sort of play with it yourself and note if you experience differences whether or not you're using a specific type of condom, like latex versus latex free, or a different kind of lube. Um,
Can you actually speak to what kind of lube you should be using? Because I feel like I've heard things about, like, how some can be non-sperm friendly, right?
yeah, so when you're trying to get pregnant, you want to use a water-based lubricant so that the
Okay.
sperm can still swim through. And so they make fertility friendly lubricants. Um, the Pre-Seed is one of them. You could find them in CVS or Amazon, and they're not going to necessarily increase your chances of pregnancy, but they are safe to the sperm. Other things like an active BV or yeast infection can cause some burning with sex, and then also pelvic floor dysfunction, which is a whole other topic. But essentially, your pelvic organs sit in a bowl of muscles that is called your pelvic floor. And if you have tightness in a muscle, things like intercourse or putting in a tampon or weird menstrual cramping can be really due to just muscle spasms within the pelvic floor.
I also had no idea how common BV was. Like, I guess I've been lucky with not having experienced that, but, like, I don't know, our traffic explodes every time we write about it.
Yeah, for sure. I mean, so BV is a infection in the vagina, and it's caused by dysregulation of the microbiome in the vagina. And so you have a balance of good bacteria and bad bacteria that are always like living in the ecosystem of the vagina. And if something changes the pH of the vagina, whether that be like a new soap that you're using or partner sperm, really anything that can change the pH and change the flora or the balance of the good and bad bacteria in the vagina and allow the bad bacteria to overpower and grow. This leads to um, can lead to pain, itching, foul
Mhm.
smelling discharge, and so that could be really bothersome to patients, especially those who have recurrence of it.
So, love this next question. Can I freeze my eggs while on birth control? I think so many women, and we could talk about a little bit about, like, the different types of birth control too, but, um, want to freeze their eggs, but, like, they don't wanna take their IUD out, for example. Like, what's your advice there?
For sure. So I get this all the time, and absolutely you can keep your IUD in place while freezing your eggs. While the ovaries and the uterus are very much intertwined in their actions, they're actually kind of separate things and you can focus on one versus the other in the fertility space. And when you're freezing your eggs, your uterus is sort of like a bystander. We're not trying to use your uterus. We're not trying to get you pregnant. It just sort of is a bystander in the hormonal treatment. And so we leave the IUD in place. We just focus on the ovaries, give the ovarian stimulation to grow as many eggs as we can. And, you know, then once we remove the eggs, you go on your way and the IUD stays in place.
What
Uh,
about hormonal what about well, I guess there are hormonal IUDs, but it feels counterintuitive if you're on hormonal birth control that, like, if you're manipulating your hormones through IVF meds, that it would be okay, you know?
Right. So, you can sort of stay on your oral combined contraceptive pills when you're freezing your eggs. And what I mean by that is you can stay on the birth control pills up until you're going to start the stimulation. And this can be really helpful in terms of like scheduling when you're going to start and manipulating the cycle start. And
I'm all
then,
about that.
yes.
I have PCOS and I can never ever predict my cycles, so with IVF, it was so useful because it's like, "Okay, I'll just stay on birth control until I"
So you're
the
ready.
IVF veterans know.
Exactly. And then once you have the egg retrieval, you can just go right back on the birth control pills. And so you are off it for that like 2-week period,
Mhm.
but you don't necessarily experience the hormonal fluctuations of like going on and off the birth control pill. It just sort
Okay,
of
yeah.
feels like you've been on it. You just get a 2-week break of not having to take a pill every day.
And you're probably not having sex during that time.
Right. Exactly. And yeah, you're told not to have sex during or, like, around the time of the egg retrieval just because of theoretical risk of getting pregnant.
Mhm.
And the one thing just to mention about, birth control pills is that, they work by suppressing the ovaries, and so if you've been on them for a really long time, it can take a little bit longer to get the eggs to start to grow in a egg freezing cycle, and so what I tell my patients is that, if you stay on the birth control pills and don't have a washout period, you could be doing the stimulation medications for 1 or 2 extra days, but the outcome is gonna be the same, and so if you wanna stay on it for all the benefits of, you know, birth control and, uh, just that you are tolerating it really well and also, like, cycle start manipulation, then stay on it, and if you end up, you know, giving yourself the injections for 1 extra day, that's a small in my opinion, a small price to pay.
Women's health in the wild, must reads, must sees, and must tries for your wellness journey. This week, we're going to be talking about a recent study out of Denmark that explored whether hormonal IUDs, speaking of birth control, slightly increase the risk of breast cancer. So, in this particular study, researchers followed about 78,000 women, comparing those who used these IUDs with women who didn't use hormonal contraception. They followed them for about 7 years and found that IUD users had a small additional risk around 14 extra cases per 10,000 women. And this increase is similar to the risk linked to birth control pills. But 14 doesn't seem like super significant to me. So wondering what your take is, Jenna.
Yeah, for sure. So, first and foremost, like when you have a really large population that you're studying and the incidence of the disease is pretty low, meaning rare,
Mhm.
really small differences between groups can end up looking more significant than it actually is. Like an increase in 14 cases per 10,000 women is pretty low.
Mhm.
Weirdly, in this study, the duration of IUD use did not impact the risk. So, whether the patient had an IUD for 1 month or 5 years didn't seem to make a difference, which doesn't really make a lot of sense. You would think that if the longer you had the hormonal exposure, there would be more risk, but that's just not the case here. So, this really makes me think that there might be some other confounding variables that are driving this difference in the groups that we're seeing. Like maybe it's like weight or alcohol intake or age at first delivery of a baby. Like these things can all impact risk. Um, and also, what the headlines didn't mention is that there's are all the benefits of the levonorgestrel IUD. So aside from being the most effective form of birth control, they can also be used for treatment of pelvic pain and heavy bleeding, and also have an estimated 35% reduction in the risk of cervical cancer, a 50% reduction in the risk of endometrial cancer, and a 40% reduction in the risk of ovarian cancer.
Wow,
So,
mic
yeah,
drop.
exactly.
Well,
Uh,
and that's honestly why we wanted to talk about this because I feel like so many headlines are so fear-mongering towards women and their health and, like, yes, okay, that was their findings, but if you, I feel like if you're a layperson who's, like, reading a study, you don't really know the nuances, and that's why this is so important.
for sure. Ultimately, I'm still a huge fan of the levonorgestrel IUD. But whether or not it's the right contraceptive for you really just needs to come from shared decision making with your doctor, someone who really knows you and your other related risks and things that you do in your life,
Mhm.
uh, how you want to experience your menstrual cycle. We've talked about this before. I think it's a very nuanced discussion debate, based on the person.
Yep, absolutely. Love that. Um, so next I want to chat about Joy. I admittedly just watched it last night. I had been, hearing all of the buzz. And this is, for those of you who don't know, the Netflix drama that delves into the true story of the world's first test tube baby, IVF baby, Louise Brown, in the UK and the groundbreaking medical advancements that led to her birth, but really it follows, like, the people that made it happen and put a face to the names, and, they really revolutionized reproductive health. I was crying at every I mean,
I know,
all
right?
3 of my babies are IVF babies, so I was, like, not surprisingly, but, like, super emotional.
Completely. I mean, and the women who initially were uh, part of the who were part of the initial studies, they called themselves the Ovum Club, and these are,
I
like, the
know, I just
the
got chills
women
again, I'm like
right? Oh my gosh. I love them, and, the steps that they the sacrifice that they made and the to be a part of this research to, advance IVF as we know it, just, like, truly incredible.
Yeah. Well, there was one quote that I, pulled because I thought it was so powerful, but when, Jean Purdy, the nurse and embryologist, was, like, arguing for the funding for IVF, she said, "There are women out there, lots of women who believe if they can't have kids, they have failed their marriage." I can't even get through it. And themselves, they don't understand what life is without children, and I thought it was so powerful when, like, these scientists on this panel, like, didn't even see the value, but then the scientists who are working on IVF are getting, like, all these letters from parents who can't have kids and
I have the
are like,
chills.
"I know, like, please help me," and, like, just the fact that that's, like, wasn't even an option and that they were putting themselves, like, basically as, you know, test subjects for this process that, like, may or may not have worked. It was really powerful.
For sure, and I mean, just, like, nerding out a little bit, it was just so incredible to me to see the how far we've come,
Yeah,
and how fast this field moves.
yep,
They were, initially started with transferring embryos at the wrong time. They didn't know that it had to sort of be there was a window of implantation, and we know that now, and,
yeah,
Jane Purdy was in the movie, was the one who decided, like, "What if we just follow a normal menstrual cycle and put the embryo in at the time where it would normally implant inside the body?" And that
yeah.
was, like, what led to the first pregnancy,
And then
and
when they were
now we're
talking about supplementing with estrogen and progesterone because the levels were all over the place,
right.
yeah, I thought that was cool too.
Yeah, now we're talking about Receptiva and all these things, a way that we can, like,
Yeah.
modify,
But that's such a good
cycles.
point to make because, like, I think a lot of people and I didn't even realize this until I was in it myself, but, like, it is such a young field still, and there's, like, innovations happening every single day. We go to ASRM every year, the big conference, and, new studies being presented, new, research. Like, I'm personally, I think I was telling you, like, really excited about finding more about the connection between autoimmune,
For
stuff
sure.
and fertility, and, like, that is all coming down the road, and that's so exciting.
Yeah, there's so, many parts of fertility that we don't know about yet. There's so many parts that are in its infancy, yet we've come so far. So yeah, I'm very excited for the future of this field and to see how good we can make this treatment.
Amazing. I want to watch it again now. But yeah, everyone, and if you don't know a lot about IVF, I think it's also really cool to just, I don't know, I love like nerding out on history like that too.
For sure, for sure.
Thanks for tuning in to From First Period to Last Period. If you enjoyed today's episode, be sure to hit subscribe so you don't miss any of our future conversations.
And don't forget to share this with your friends, because when it comes to women's health, we all deserve to be informed, empowered, and supported.
Still have questions? Email community@rescripted.com for a chance to have yours answered on a future episode. For more science-backed women's health content that meets you exactly where you are, head to rescripted.com or follow us on social at Hello Rescripted.
We'll see you next time with more real stories and expert advice.